Fantastic. So, without further ado, we would like to call upon our first speaker, a nutritionist by profession, and she will talk to you a topic, and she will share with you a topic very close to our heart, which is important for all of us, which is fertility lah. Can we put our hands together to welcome upcoming master Pamela?
My brothers and sisters in STFG. If you can hear me loud and clear, please give me one. Yes, good. I see a lot of one now. Okay. So I will start with a very short life cycle of a woman. Okay. So when we born, when we get birth as a child, all right, and then we will have birth cert, right? When we get birth as a girl, we will have birth cert. So even though you're a girl or a boy, you have a birth cert. So this is the first cert that we will collect. So next, after that, you will continue study, and then your parents will have expectation on you go to study, and then you go graduate and you get your next certs, which is your degree certs or master or PhD cert. Then after that, you will have another cert in your life because your parents will told you, I think it's time for you to get a lifetime partner. Then you can have another cert called MRS cert. Okay, it means that it's marriage cert. So after that, when you enter this door, the marriage door, so your mother-in-law, your mother will start to asking, when is your next cert? Your MOM cert. Okay, so this is the life cycle of a woman, right? Because woman has this power to produce the next generation, I can say that. All right, and then is this sound very familiar to you if you are a woman, or even though you're a mother, or you are or not married yet? Does it sound familiar to you? If yes, please give me a one also. Yeah. Okay, so we can see here a lot of, especially in Malaysia now, actually a lot of women, they have some challenges in getting pregnant. And then somehow or other, if we are in ancient time, women will always being blamed by not produce the next generation. But is it only woman fault, or it involve husband and wife? But in ancient, it's only woman fault because we can't produce. So now, actually, we all know that if you want to get pregnant, you must have the other half to help you to make it happen. Yeah, so we can see, based on Malaysia's statistic, from 1970, our woman childbearing age, during the woman childbearing age is about 15 to 49, according to the statistic, is 4.9% in 1970. 4.9 children, about 5 children like that. So until 2020, we only produce 1.8, not even 2. So we can see that actually our birth fertility rate and our birth rate is getting decline and decline. And somehow you will think that, yeah, if I can't get pregnant naturally, there's a lot of ways to make me get pregnant. Okay, we can have IUI, we can have IVF, we can have ICSI. So there's a lot of method. This called assisted reproductive technique, where we can have a lot of method for us to get pregnant, and we need sperm and ovum, and in other way we said is test tube baby. Yeah. So, but do you think that this is another way for those who very hunger to get pregnant and then want to get pregnant immediately? But do you think that you undergo this kind of treatment, you can get pregnant immediately? I don't think so, because the success rate is not that high. And another thing is very pricey and is invasive. Of course, there has some risk there, and it's not guaranteed. Because when ovum and sperm is fertilized outside, even though it's fertilized outside, then after that put inside your uterus, it will not guarantee you will get pregnant, because it must also based on the implantation of the cells. So somehow it's not guaranteed. And IVF is really very pricey, at least 5 figures. And not only you do once, you can get pregnant, at least 2, 3, 4, 5 times. So you can imagine if one IVF is about 10K. The first IVF we failed, we lost 10K. Second IVF we failed, lost another 10K. And if the third still fail, 30K loss. So it's very huge amount of money. And is it another way or another method that we can have to have a natural fertility? Yes, there is. We can have another way also. As now, the solution I will share to you later. So let's talk about what is fertility first. Fertility is the ability to reproduce. When men who are fertile, they can be a father of a children. And women who are fertile, they can bear a child and then they can get pregnant. And so we need a sperm and an ovum that fertilize and implant in the uterus, then bear until full term and deliver out. Then your baby is delivered out healthily. So in natural way, we must have the natural sexual intercourse. So actually a lot of causes or factors that make us infertility. So not only women are women's fault. I can say that it's women's fault. We cannot blame only on women, but we also must see whether the other half have any health challenges or not. All right. So let's look into men first. So men, if you have low sperm count, of course the fertility rate is slightly lower. And sperm low mortality means that your sperm comes swim very fast. They come swim to the end of the fallopian tube to mesh with the ovum. All right. And then abnormal sperm means that your sperm is not as healthy as it's, and erectile dysfunctions, ejaculation disorder. All right, and low testosterone means low male hormones. Sometimes it's due to radiations and also excessive heat. If you wear too tight pants or underwear, so it will cause heat, All right. And next, we look into women. So if woman infertile, it's maybe a PCOS. All right, means that the ovum cannot be released through the ovary, and And also due to irregular periods, if your periods is irregular, so we can't estimate when is your ovulation time or when is your period, so you can count when is your ovulation. And then if let's say when you ovulation you have proper temperature, proper body temperature, I mean you have the temperature to test your temperature, so you can know whether when is your ovulation time. And besides by that, block of fallopian tubes is also one of the factor. Endometriosis, where you have very severe pain when you have periods, and also the abdominal surgery or fibroid or cyst. These will these are some of the internal factors that caused by your body, sperm, and ovum. And besides by that, we also have poor diet and lifestyle. Eating outside, high fat food, and irregular exercise, and then sedentary lifestyle. We didn't eat correctly. These are all the factors that will cause our body infertile. And next, alcohol and smoking is also one of the factors. Even though as a woman you didn't smoke, you didn't drink, but your the other half drink and smoke, it will also cause infertile. Caffeine, if you like to drink coffee or tea. Xenoestrogen means that is a substances that affect your hormones like plasticizers, chemicals, or the pesticide that will cause our hormones imbalance. And excess stress, especially in the environment now, where we are under stress, and then this stress, if you didn't overcome the stress, it will also cause you infertile. Medication, if you have long-term medications, and the chemotherapy, if you undergo chemotherapy before, and there's challenges for you to get pregnant. And the last is the age factor. If you so from the chart here, you can see that if our age is more than 35, our infertility percentage will getting higher and higher. So age is another factor as well. But if we take care of our diet, we take care of our body, so I don't think age is a factor, because I will show you why age is not a factor later on. And so here I want to share with you the nutritional answer for fertility. So with these supplements, with Shaklee supplements, we can have very fertile body. So whenever you get ready for pregnancy, you will get it. You will see two lines. What of two lines? That what I mean of two lines? Have you ever heard of two lines? You know what is two lines? Yes, positive from your pregnancy test. Yes. So it's not from COVID test, because we don't set COVID test. No. Okay, two lines means you are positive in your pregnancy test. So with these nutritional supplements, it's very, you will guarantee with a cost-effective way, and then you can have a peaceful mind to take these supplements, and you will not under stress. So first we go into ESP first. Protein is the key ingredient for our cells. Every of our single cells in our body need protein, and we build up of protein. So we must take protein every day. So how protein helps in fertility? First, it helps on sperm mortality. And besides by that, it will increase the sperm count. And also it will, and soy, they contains isoflavones. Isoflavones is the similar hormone structure to estrogen. So it will help women's hormones in a balanced way, and it will also improve fertilization. So if you have healthy ovum, healthy sperm, when they successfully fertilize, it will successfully implant in the uterus. And next, vitamin E. Vitamin E is very essential on, especially on male. Okay, so it's on sperm count, and also it can help to prevent the free radicals and also protect the sperm. All right, and it will also improve the sperm mortality and quality. So when our sperm can swim faster, can swim healthily, then it will reach the end, the ovum, and fertilize it. And next, our vitamin E contains selenium, where it will have enhanced the vitamin E function and maximize the sperm formation. And for women, it helps on the increase the cervical mucus, because if we lack of mucus, it's also it will cause the sperm come swim into the end of the fallopian tube. All right, and it also prevent the eggs defects, means our ovum will be a very healthy manner, in very healthy shape, and healthy cells. And next, it will prevent the chromosome breakage and also prevent us when we successfully get positive in our pregnancy test. It will prevent miscarriage and also birth defects. And next, zinc. Zinc actually a lot of people very familiar on zinc, and then they think zinc only for men, but zinc is for both. So let us look into men first. Zinc actually helps in reproductive organ growth, and also it also helps in produce the male's hormone, the testosterone hormone, and it increase the sperm count, because as your sperm count is high, means that the chances for your wife to get pregnant is higher. If you have less sperm, means that it's very risky whether your wife can successfully get pregnant or not. All right. Then next, zinc can also is a very important nutrients that need to protect the outer layer of the sperm head and also tail. All right. So it will prevent abnormal sperm. And besides by that, for women, it can help to attract and hold the reproductive hormones like estrogen and progesterone. These two hormones is very important when we want to get pregnant. So these two hormones must at the optimum level. And besides by that, it also helps when the ovum and sperm is fertilized. It will also help the fertilized ovum to travel to the uterus for implantation. And omega guard. Omega guard is very essential in fertility set, and omega guard is very rich in omega-3, where Shaklee omega guard has 7 spectrum of omega-3, where you only can find in Shaklee. So omega guard can help to helps the semen, means the sperm, to is a very rich with prostaglandin, is another hormones. All right, another hormones where it needs omega to produce these hormones. Every hormones need good fats to produce it, no matter male's hormones or woman's hormone or other parts of hormones in our body, all needs omega. So even you are not yet want to get pregnant, or you don't want to get pregnant already because you have already had 3 to 4 child, or you are elderly, you must take. All right, no matter what age you are. And next, omega guard is a very essential and for our uterus health. and because it can reduce the inflammation. So because when our body undergo inflammation, it will interfere the hormones and also other parts of our body that we are quite difficult on when we want to get pregnant. It's quite difficult for us to get pregnant. And next, CoQ10. CoQ10 is another nutritional supplements that can help in fertility, where it can help in man's sperm as well. So let's look into it. It will increase the sperm count and sperm mortality. Is it very important? It's very, very, very important. So you can see this when we have enough sperm count and our sperm can swim in a fast manner. It's very good. And next, and this helps the mitochondria because CoQ10 can produce the energy in the our cell as what we having as the mitochondria we always heard in physics. So we have the energy. The mitochondria is the battery in our cells. So we will have the energy to boost it. So when cells sperm and ovum is also part of the cells. So when our cells have the energy, so the sperm can swim faster and the sperm count is in a sufficient level, and your ovum will have your ovary will have the energy to produce the eggs, needs to produce the ovum out, release the ovum out through your ovary into your fallopian tube and then fertilize and implant to the uterus. So it's very important. And next, it will protect the egg cells from damage because it's very high in antioxidants. So it can clear all the, remove all the free radicals in our body. And next will be GLA. GLA is very essential too because it's very rich in omega-6. So from here, it can help us to regulate hormone, especially the testosterone hormone for men. And for women, it will help on estrogen hormones. As what I said just now, hormones is very important in pregnancy. So no matter male or female, we need to have a balanced hormone. So we need good fats. Okay, it means we need essential fatty acids. And it will also increase the cervical mucus and also reduce the inflammation because good fats can help us to reduce inflammation. Besides by that, it also can help the uterine muscle to have strong uterine muscle so that you can get ready and to prepare the pregnancy, so that when your ovum is fertilized and then implant to the uterus, it's able to carry until full term. Next will be vitamin C. Vitamin C is also very crucial in sperm and also ovum health. So let's see. Besides by sperm production, it also helps in the mortality. So you can see that it is very important when we talk about fertility, and we need enough sperm. The sperm must be motile enough, must swim fast enough, and then the production must be in the optimum level. So the more that you produce, the higher chance that it can fertilize into the ovum. And next will be prevent the sperm clumping together. Okay, so they won't jumble up and then stick all together. They will be individually swim and then to the end of the point. And next will be vitamin B complex. So B complex is very important when we talk about reproductive. So it can help us to have a very healthy reproductive organs, and also helps to reduce stress, and is very essential when go into synthesis of RNA and DNA. And besides that, it's very important after we get pregnant as well, because it can help to prevent the birth defects and also assure the development of the fetus. And last but not least, Vivix. Vivix is very high in antioxidant. So as we know that it can also helps on regulate our hormones, no matter male's hormones or women's hormones, and also detox at the cellular level. So before we want to get pregnant, so let's have Vivix 7 days detox. So if you don't know what is 7 days Vivix detox, it's okay. All right, you can ask from your friend who invite you into this Zoom room. You can ask him or her. Okay, he will explain to you clearly or send you a video. You can just have a very fast understanding about 7 days Vivix detox is very crucial because when we have healthy cells, our body will replicate or duplicate or produce a lot of healthy cells. So when the healthy cells, when our body is refreshed with all the healthy cells, means that your body will have the preparation and healthy pregnancy. So when you have healthy pregnancy during your pregnancy period, you won't have any discomfort. You will enjoy the whole term of your pregnancy and labor your baby healthily. And next, it's also the 4 key mechanism of cellular aging, where it can help us in anti-aging. So when our cells is very healthy, no matter how old you are, all right, no matter you are 35, you are 40, your chance to get pregnant still there. And it's a revolutionary dietary supplements where you only can find this in Shaklee. And as what I mentioned just now, it's high antioxidant and it is anti-inflammatory, so it assures your cells is healthy. So, and why we must choose Shaklee? And why Shaklee is so different than other supplements out there? Because Shaklee always safe, always works, and always green. So it's everything that every ingredients, every raw materials that they they uh they they will have they will tested everything and they will have clinical tests. So they will test everything on human and then confirm everything is safe and works and green, and they will then it is very safe for us to consume. And you can see that I will want to draw your attention to the landmark study. And from here, we can see that Shaklee landmark study, and you only can find this in Shaklee. And it's undergo with 3 groups of people, where the first group of people consuming Shaklee multiple supplements, means they're taking a lot of different types of supplement from Shaklee. And then second group of people, they only take single supplements, single multivitamins. All right. And then the third group of people is they didn't take any supplements at all. So from here, we can see that for those who take Shaklee supplements, they enjoy greatest health. So they take little to no medication, their body inflammation is very low, and they have a very healthy body. They didn't even have like high blood pressure, high cholesterol, high blood sugar. They will not have this kind of health challenges. So I would like to share some testimonials, and the most impressed one is this lady called Jackie McCoy. Jackie McCoy, she is a very overweight lady. So overweight or obese is also a factor that we can't get pregnant. So I listened to a story this morning. She said she want to get pregnant, and then But when she go to a doctor said because of her weight, okay, because of her weight, she can't get pregnant. And doctor chop on her. You never get conceived with this weight. So she determined and she decide to lose weight. So she lose weight, and then now she have 3 little cute daughter because she lose weight with Shakti supplements. Then she has a regular exercise, healthy diet, complement with Shakti supplements. So you can see she has 3 beautiful daughters. And next, our presidential master Emma from Taiwan. So she get pregnant at her age of 40. So this is even though you are 40, you are 35, you are 30, or you are 20s, age is not a matter. Age is not a matter. And besides by she successfully get pregnant at the age of 40, and then she gave birth at the age of 41. So she also has a very cute daughter. And now,
Hello, Pamela. We can't hear your voice, Pamela.
after she gave birth,
The sound is breaking up. Yeah.
all right. Okay. After she gave birth, she very fast to slim down and just in 2 months time she slimmed down and then get back to her original weight and figure. So you can see, even though she's at her age of 40s, she's able to get pregnant. And last but not least, everything comes to you at the right moment. So even though you are not pregnant now or you want to get pregnant in future, be patient and be relaxed because the good things comes to you later. So I will urge everyone to take the supplements now, to take Shakti supplements now, and make sure you have healthy cells and healthy body with healthy lifestyle, so you will have a natural fertility process. So I wish all of you all the best, and I pass back the floor to MC Master Halim.
Thank you, Pamela.